My name is Raz Penmatcha. I am a comprehensive ophthalmologist that specializes in complex cataract surgery, glaucoma, oculoplastics, and medical retina. I came to the United States when I was at the age of 3. I was raised in a small town called Taylor Ridge, Illinois. It's located in the northwest corner of Illinois along the Mississippi River. I went to medical school at the Chicago Medical School. And during my 3rd year of medical school, I had the opportunity of rotating through a ophthalmology rotation. At that moment, I knew that's what I wanted to do for the rest of my life. Ophthalmology encompassed a little of all of medicine, which I liked. You get to treat children, you get to treat adults, you get to treat men and women. And what I also liked about ophthalmology is that you get to treat diseases with medicines, and you get to treat diseases with surgery. So it encompasses a little of all the fields of medicine, and that's what drew me. And what I liked about ophthalmology is that it continually gets better. The technology keeps making me want to learn. I applied for ophthalmology and I matched at Wayne State University Sinai Hospital, Detroit, which was a fantastic training program. We got to do a lot of surgery and we got to deal with a lot of complex medical ophthalmic problems that made me very comfortable getting out of my training. Shortly after my training, I decided to start my own practice in my hometown. And I was a solo practitioner for about 10 years. And then after about 10 years, there was a large multi-specialty ophthalmology group in my area that I integrated my practice with. And this was the best decision I made. And the reason why was that I was surrounded by a lot of subspecialists in ophthalmology that further enhanced my medical skills and my surgical skills, because I learned from each and every one of them for over that time period. And I became a well-rounded surgeon and a well-rounded ophthalmologist, and it just made me such a better doctor. After close to about 3 years, my wife and I realized that the Midwest, where we lived in Iowa, the weather was absolutely horrible. And for about 6 months out of the year, all we did was huddle around the fireplace. At that time, my wife and I said, you know, we are not living life 6 months out of the year, and we decided that it's probably best that we move south. And there was a handful of states that I was looking at. When I flew into North Carolina and visited Fayetteville, at that moment I knew that this was the place that I wanted to be. The reason why I loved Fayetteville was the weather was truly amazing. You get all the seasons. At the same time, you don't get the extreme weathers of Iowa. I also liked the fact that Fayetteville was a great place to raise a family, had great school districts, and it was a small-sized city that I was kind of accustomed to. But it had access to mountains, oceans, and cities if I ever needed to have access to. So I loved the city of Fayetteville. But what really drew me to this area was the practice, Cape Fear Eye Associates. When I visited Cape Fear Eye Associates, I realized that this practice, the number one thing on everybody's minds, from the receptionists to the technicians to management and to the doctors, was patient first, patient care. I knew at that time that this is the type of practice that I wanted to be in. The practice also was at the forefront of technology. They never compromised on buying technology that can help the patients. So it was like the perfect match for me. It thought of patients as being number one, and it also thought of what can we do to provide these patients with the best care with technology, and it offered that. I also liked the fact that Cape Fear Eye Associates was not only involved with practicing eye care, but it was involved in nourishing the roots of Fayetteville to become better. It sponsors many community services and is very much involved in community events that, in order to be a good eye care provider, we also know that we have to help the community. And if we improve the community, it'll help everything that we do in this area. So basically, I love this area, I love the practice, and I'm very fortunate to have the opportunity to be involved with providing eye care to this community.